Telemedicine may turn out to be the biggest permanent change that we'll see in the U.S. healthcare system. I'm being in touch now to talk for a minute about the wild and crazy changes going on in healthcare regulation in the coronavirus era, and particularly about telemedicine. Of all the changes that have come out in the emergency rulemakings for accommodating the coronavirus, telemedicine may turn out to be the biggest permanent change that we'll see in the U.S. healthcare system. It's going to be a lot more than some 21st century version of a house call. It's going to change the way that the patients find their physicians. It's going to change the tools that physicians have, and it's going to change the other kind of care that physicians can open up to the patients. So all of a sudden, high-tech products, all kinds of health technology, software, monitoring, a lot of different healthcare that gets billed is now going to be covered. There's going to be really a revolutionary growth in utilization. Some of that is good, some of that is bad, some of that is downright criminal. And I'd like to try to explain that for a second. See, the healthcare system was ready for telemedicine a long time ago. And there's been a lot of lobbying for it. And finally this change happened, boom, with one pandemic. But one thing didn't happen at the same time. You need some controls to keep some of the bad actors from using the openings of telemedicine to oversell a lot of equipment. Electric scooters in the past were a big issue, tilt chairs, diabetic supplies, things that in the past didn't require a real prescription. Well, now it's open to anything, even if the doctor prescribes it. There's some risks, and we've built into the system, we've hardwired the benefits, but we haven't quite tweaked all the controls and all of that. So let's see how this works in real life, okay? Patient visits the doctor, so there's a bill for the office visit. Next, the doctor orders some lab work, so there's a bill for the lab. So far, so good. And now, with the change in scope of practice rules, you might have that being a physician assistant, a nurse practitioner, an OT, a PT. Someone else could be ordering all kinds of equipment now, and it gets paid for. It's fully covered. That's really good if you're talking about a patient often in a rural area, or a medically underserved area, or a patient who's not mobile enough to get to the doctor easily. These are all good things. But you could be setting up a phone bank with a lot of folks robo-dialing 1 million people and finding 10,000 people to call for medical consultations with 10,000 expensive pieces of equipment and no controls on them. So we're not quite there yet. At this point, what I'd like to say is, look, I'm really in favor of expansions of telemedicine coverage, 100%. And there are some important technologies in the works now that won't be able to make it unless these changes are permanent. So all of this is good. But now I think is the time to ask about telemedicine. What's the benefit going to be, and what's it going to cost? And how do we set up that balance there as we turn these crisis level regs into more thoughtful, permanent coverage expansions that I think we all need? Those are my thoughts, at least. Thanks a lot for listening. Bye.